Hi, this is Dr. Emily Park with your next Functional Health Minute. I'd like to talk a little bit about evaluation of mental health disorders. So, in functional medicine, of course, we like our questionnaires. We like to collect a lot of information before a visit. It really helps us be able to fully think about your case and to also formulate other questions that we might want to ask you during your visit. So, of course, we collect an MSQ or medical symptom questionnaire before every functional medicine visit. And that's not specific to evaluation of mental health, but it is important because, as we know, mental health issues can have manifestations of symptoms pretty much anywhere in the body. So, we definitely want to know all of those that are going on. So, when it comes to evaluating specific mental health conditions, I'm going to talk about depression first. My favorite questionnaire, because it's been well validated, is something called the PHQ-9. So, it's a questionnaire that we ask people to fill out and evaluates what the severity of depression is. If you score anywhere from a 1 to a 4, that's considered minimal depression. 5 to 9 is mild. 10 to 14 is moderate. 15 to 19 is moderately severe. And 20 to 27 is severe depression. So that helps us kind of gauge where you're at. And that's important because we'll be using it as a tool as we go along with whatever treatment modality we're doing. Next is the GAD-7, and this is for anxiety. This is a general anxiety questionnaire, and it's a relatively simple questionnaire. And the evaluation goes as follows: if you score 5, it's considered to be mild. If you score a 10, it's considered to be moderate. If you score greater than a 15, it's considered to be severe. Now, what if you get a score of a 7? What does that mean? So that means you're somewhere between the mild and moderate. And if you get a somewhere between 10 and 15, you're between moderate and severe, and et cetera. So collecting that is important, an important evaluation tool for anxiety. The next questionnaire I like to look at is the PTSD-5, and it basically asks a series of questions. It's very short, but it asks a series of questions about if you've, had an event that would be considered a trigger for PTSD. Um, and, pretty much if you have a score of 3, especially if you're female, the research says a 3 or more tends to indicate that PTSD is likely, but definitely a 4 or more indicates that it's very probable. And then another questionnaire I like to collect is called the ACE, and it's Adverse Childhood Event Score. And we know that if an ACE score is 4 or higher, that means that person is at risk for chronic diseases and social and emotional problems as well. So, again, those are some of the questionnaires that we like to use in evaluating how someone is doing, because it does become difficult to just talk about, like, how are you doing? Oh, I'm not doing so well. Well, what does that actually mean? How do we quantify that? And that's actually a pretty big challenge in mental health overall. So the questionnaires are really good tools that help us kind of determine where we're going in the right direction. And all of these questionnaires are questionnaires that I collect as part of someone who's being evaluated before ketamine infusions. And depending if which ones are high, um, or abnormal, even, I'm going to collect those before every infusion because I actually want to know how you're doing. Besides your verbal report on how you're doing, which is also important, collecting the scores is like one of the most objective ways we have of knowing and assessing if things are working or not. And what we're looking for is, at least, greater than a 50% response for any treatment. So whether that's ketamine infusions or diet and lifestyle or supplements, whatever it is that we're doing, we want to be able to properly evaluate a response. This is Dr. Emily Park with your Functional Health Minute.